So today we are here from Mr. Ahsan Jamil, and he is going to tell us what is Aman Foundation, who is the CEO of Aman Foundation.
Okay, so Aman Foundation is a not-for-profit, a trust that is recently been incorporated a little over 2 years ago, and we're focused on health education and nutrition. And the first project we started off with was a nutrition program at low-income schools in Kharachi, which is a low-income area in North Kharachi. And since then we set up an ambulance service, started with 10 ambulances with life-saving equipment as well as doctors and trained nurses. And now we have 100 ambulances and we're covering the entire city.
Beautiful.
And we only deal with life-threatening and serious calls. We don't deal with, for example, we don't transport dead bodies. We do not transport people to, we are doing a little bit of it, but it's not a high priority, which is if somebody wants to go for dialysis or something, we refer them to other ambulances, etc. Because if you've got doctors and you've got equipment, then it's a waste.
Yes, that's right.
Resource. We've done about close to about 200,000 interventions in these 2 years, which also includes 80,000 medical interventions when the flood hit Pakistan.
Wow.
So we had about 22 of our ambulances working as mobile clinics, because they could actually be at the areas where the floods, the flood affected populations were actually stranded. So we did that. We even imported some boats and did some water paramedic work and rescue work, which was quite intense.
How many people is working for the foundation for that part, or altogether?
Altogether, there are about 1,250 people. And I was just making some slides for a presentation. The next year we probably get pretty close to 2,000 people.
Very nice.
So we run it like a business. It's a not-for-profit, but the whole work ethic is that of a business organization. It's got to be transparent, it's got to be accountable. We've got KPMG as auditors. And everybody's paid a salary according to market. And the idea is that if you want to tackle such a difficult problem as poverty and health and education in a country like ours, then you've really got to put your best resources at it. And so attracting really good resources has been one of the challenges of this organization, so building a team. Very happy to say we've gotten ourselves a fantastic health team, now being led finally by Dr Zsu, who used to be at the Ahsan, he's former faculty at Yale. He's an emergency expert. He's got a PhD in public health, and he is something of an international expert on emergency medicine. So with him now, we're hoping to be able to have an ambulance service and a pre-hospital care.
Oh, wonderful.
That is, second to none, and affordable for all. So that's the key thing. So how do you manage that? So we have a cross-subsidy model. So if you want to go to a government hospital or ambulance, the charge is, 1/6 that if you want to go to a private hospital. So it's a little Robin Hood model.
Yes.
So people who want to go to private hospitals obviously can afford to pay the full whack. So our struggle right now with the ambulance business is how do we make it sustainable? We built it, it's quality, there's fairly good short supply, and now there's always room for improvement, but we feel that if we can solve for the sustainability bit, then it's a service that will exist, and it will also role model what is possible for the government to have done.
Yes.
Ultimately, the idea is, with other projects like this, that we want to be able to show the government that this can be done, it can be done cost effectively.
Yes.
And, if you want us to do it for you, we're happy to do it for you. We'd like to do it for you, or other people can copy it, or we can partner with them, etc. So, we've got the London ambulance software, so triage is happening. You can start getting help from the moment you call up on the telephone, as well as a new project that is right now in a testing phase, it's being piloted, is a telehealth, like NHS Direct, something similar to that. We got this project out of India, where in Andhra organization, Hyderabad. They have a call center that's working very well. And in fact, it's exciting because it was set up by a private sector organization, their foundation, and now it serves the government.
Hmm.
So,
Interesting.
yeah, it's a health management research institute.
Yes.
And it's got this ambulance service and it's telehealth. So, I went and saw that, and we decided to do an arrangement with them and get that going on there. So, Hyderabad is right now with a team of doctors bringing it online.
What do you do for public health right now? Like, how do you educate the public? As you were mentioned that one of your segments is on public health. I was just wondering
So,
what technology are you using?
well, when you think of the telehealth, right?
Mm-hmm.
So that has a certain element of health advice, health information. So we also have a database. So if somebody wants to call up and ask us what's the nearest doctor, ENT specialist I can go and see. So that could be something that we can direct them on.
I
That
see.
database is available. What we are intending to do is to set up a Institute of Urban Health.
Mm-hmm.
And we are in the process of getting somebody on board who's got a lot of expertise in public health. So a community health worker program is something that is under design. And the idea here would be that if we could get about 650, 700 community health workers trained who could cover populations in Kharachi, low-income areas, and work like a sales team that goes there, shares information, and we want to have them of a higher quality. You might be familiar with the Lady Health Worker program that the government has.
I haven't heard of it yet.
Okay, so that's a pretty large program. It's very successful. And what we want to do is to actually do something akin to that, but which is of a much higher quality. So the people would be paid much better, trained much better. So you have nutrition, hygiene, reproductive health, mental health, all the basics available for these community health workers
Right.
to be trained in and to go and
How do you ensure the high quality training to make sure that it always remains the same and and how are they giving the information further down to the public?
So obviously various quality assurance systems will accompany everything that we're doing. So whether it's the ambulance system or the telehealth or the community health worker program and constant training. We also are
So it's always face-to-face training?
Right now, as I said, that program is still to be launched.
Okay.
So we will be examining what are our various options for training. We also are running a vocational training institute, which right now, Aman has about almost 1,000 students. We started it in March. We're affiliated with the City and Guilds Vocational Training Institute organization out of the UK. We've got right now auto repair, we've got electrical, refrigeration, etc., etc.
Just like the Hunar Foundation, I believe. I visited them, so this is sorry for saying that. This is what I know.
Yeah, well, it's in a way, except that I think this is being done at a larger scale and is being run by the former CEO and chairman of Philips. So he's working as a full-time employee of the Aman Tech. And again, it's being run like a business. And what we're hoping to do is grow it to about 5,000 students. We want to create a boarding lodging facility over there. And I think one of the biggest problems we have in terms of Pakistani manpower, or usually come up to par with skills, but they tend to run into trouble in terms of soft skills. So along with the technical skills and the accreditation from City and Guilds, we would be looking to have them trained with computers, presentation skills, general shared resources, how do you live in shared space, stuff like that.
Yes.
English,
Yes.
and if you're looking at the Middle East and maybe Arabic.
So you are exporting these workers basically outside of Pakistan?
Well, it's their choice, but we would certainly facilitate that.
But
Because,
yes. So you are like a headhunter, gonna act like a headhunter to place these people into jobs?
in a way, yes. We would like to be able to provide them with placement. Our chairman and our principals for the foundation live in the Middle East, Pakistanis who've been very successful and have a huge philanthropic spirit, remarkable people who made this possible, and not just with their money but with their active participation. And we've had McKinsey, for example, coming in and spending 3 months with us to make our strategy. So when you're and they have a big social sector business, McKinsey a lot. And it's been very interesting to be able to look at poverty and education and health like a business market. And yet, the bottom line is very different.
Right.
It's all about impact. How can we change? How can we shift the needle on death and disease in Karachi? Our focus right now, to begin with, is Karachi. And how can we, train people such that they can go and work, be competitive regionally, and therefore earn 5, 6, 7 times what they would earn here. And the knock-on impact of foreign exchange coming to Pakistan and what happens to their families when they receive, so much more income. The education cycle, the health cycle, all of it gets impacted. So what we have in a way is nutrition, and first the stomach, then health, and that's well, what can you do, and then of course training.
Right.
We are also starting a program which is underway on teacher training. So it's called Teach for Pakistan. And what we're doing is we're attracting about, we've gotten, I think, about 60 fresh graduates from some of the top schools in Pakistan to opt for teaching in under-resourced schools. And we're paying them, a competitive salary, and they're going to be working at government schools, and we're training them for 2 months and then putting them out there with our mentors and field support people, so that they can, this is the best and the brightest. So you've got them from IBA, alums, and you've got about 15-20% of this cohort coming from American colleges, like Northwestern and some other well-known universities, only to come and work in Pakistan. It's a 2-year commitment. So what we expect is that in 3 years we should be able to take this from 40 or 60 to about 240 such fellows, as we call them, to be teaching in different schools. And the idea is, it has a number of benefits. It, of course, provides the students they teach with very good quality teaching compared to what they're getting right now. Secondly, these teachers these fellows will raise the bar for other teachers, etc.
Right.
And what's more is that a lot of them will actually stay in the field of education. And those that do this program because they become very good prospects for the corporate sector. We love IB and graduates, but we've also had this education experience.
Right.
That they're hot commodities for leadership and their perspective and all of that. But a lot of them will continue to be advocates for education. If we want to make education top of the agenda, because it sort of feeds into lots of other issues. So on the one hand, you have a corrective plan with nutrition and health, with their own preventative aspects too, but education sort of feeds into it.
Right.
So we at Aman want to be able to do this to some scale in Karachi, and to act as a catalyst then for this happening in collaboration with lots of partners, because we understand this problem is huge, and we believe that if we can create alliances and partnerships and collaborations, then things can change, and they can change quite
impactfully.
Right. Significantly. And so we're really excited to be part of this effort.
Wonderful. Thank you for this lovely introduction.